So, thank you for attending our last session of the 2022 North Country Leadership Summit. We're going to end with a bang. Optimizing healthcare, community collaboration, and workforce resiliency. Just want to give a quick thank you to all of our sponsors this year. Without our sponsors, we couldn't make our event successful each year, and so we truly appreciate their support each and every year. And then just a couple housekeeping items. Please place all your questions and comments in the chat. We will make sure that they are addressed during the Q&A portion. We're asking that everyone remain muted with your video off for the presentation. And then all presentations will be recorded and archived on the AHI YouTube page, as well as the North Country Leadership Summit webpage. With that, I'm going to turn it over to Valerie and Melissa to introduce themselves. And if you want to go ahead and share your presentation.
Hello, everyone. My name is Valarie Drown, and I am the director of the Alzheimer's Disease Caregiver Support Initiative and also the Caregiver Wellness and Respite Center. And our office is located in SUNY Plattsburgh, New York. So I'll turn it over to Melissa, and we'll be talking more about our programs that we collaborate with.
Hello, everyone. I'm Melissa Fischler. I am a program manager for the Alzheimer's Association of Northeastern New York. I cover Clinton, Essex, and Franklin County, and our service area are the northern 17 counties of New York. So Valerie's organization and my own, we have the goal to increase reach and access to services. There aren't enough people who do what we do, and so we work collaboratively to be able to provide the best services and reach as many people as we can. Our vision at the Alzheimer's Association is a world without Alzheimer's disease and all other dementias. We don't just provide support to people with Alzheimer's disease, we provide support to people with all dementias and caregivers. So these are some of our facts and figures. As probably many people on this presentation know, most people will either experience some form of dementia themselves, they will have a loved one who experiences some form of dementia, or they themselves will be impacted in some way. They might be a caregiver. Our most current facts and figures are that over 11 million Americans provide unpaid care for people with Alzheimer's or other dementias. And those caregivers provided more than 16 billion hours, valued at nearly $272 billion. We're going to go over some of our resources really quick, and that way we can talk a little bit more about how we use those resources together to provide quality services. I'm going to turn it over to Valarie.
So through the Alzheimer's Disease Caregiver Support Initiative, we have a number of objectives that we are looking to meet to improve the lives of caregivers within our 6 counties, which are Clinton, Essex, Franklin, Warren, Washington, and Hamilton. So we start with caregiver assessments. So those are provided by regional care navigators, completed at a location that best meets the needs of the caregiver. So we're not really forcing them to come into any kind of office setting. We are willing to meet them in their homes or in their offices, in our offices, in other public meeting locations, such as offices for the aging, public libraries, coffee shops, over the phone, and virtually. So we try to make it as accessible as possible for people within our rural communities. We also offer support groups. So through collaboration with the Alzheimer's Association, we offer support groups in all 6 counties of the region. And our goal is to utilize volunteer support group facilitators. But for those groups where a volunteer is unavailable, the Alzheimer's Association and the Caregiver Support Program, we work collaboratively to facilitate and then co-facilitate when possible. We have memory cafes. So during these events, caregivers and the individuals living with dementia have the chance to socialize. They're surrounded in a safe and supportive environment by other caregivers and individuals with dementia, because what we know is sometimes going out in the public is very difficult if our person with dementia has behaviors that make it a little bit socially awkward. So our wellness specialists, we plan these events based on the interests of participating caregivers and individuals living with dementia and the availability of instructors. Respite. This is a very popular piece of our program. So caregivers of individuals with dementia are provided with financial assistance in the form of vouchers that can be used to pay for respite care, allowing the caregiver a much needed break. So we offer 5 different forms of respite through a voucher program. And so those are in-person or in-home respite. We offer day programming. We offer consumer-directed assistance. We offer short stay beds in a facility, and we offer emergency respite. So in addition to paid respite, the regional care navigators assist caregivers in identifying their own natural support team. And we encourage them to develop what I like to call the support squad of families, neighbors, community members, friends that they can lean on for assistance. Because what we know is that caregivers often don't identify themselves as caregivers. So it might be that person who comes over to mow the lawn, or the person who goes to pick up groceries for someone. Those are our support squad. Those are our caregivers out in our community. We have Project Lifesaver. Project Lifesaver is a program designed to protect and, when necessary, to quickly locate somebody with a cognitive disorder who is prone to life-threatening behavior such as wandering. So we work in collaboration with sheriff's departments in all 6 counties to offer this service to caregivers. And this, I think, is fascinating. So there have been 5 documented saves for individuals enrolled in Project Lifesaver through our Caregiver Support program since we started in 2016. So in October of 2018, Washington County located the individual within 15 minutes. December of 2018 in Warren County, we located the individual in 23 minutes. July of 2017, Warren County, located in 9 minutes. June of 2017, Warren County, located in 35 minutes. And in May of 2017, Warren County, located in 50 minutes. So what a great service, and something special for the families to be able to locate these individuals, especially in our North Country region where it gets very, very cold and health can deteriorate quickly. So I'll move on to Music and Memory, which is a new program that we're offering through the Caregiver Support. And it's a nonprofit organization that helps individuals with a wide range of cognitive and physical conditions to engage with the world, ease pain, and reclaim their sense of self through the use of personalized music. So it's been proven to increase communication, reduce agitation and behaviors associated with anxiety. And when a care receiver is engaged and is listening to a personal playlist, the caregiver may be able to get a short break or a reprieve from care without the need for a formal support. So it assists with respite. The increased bonding and reduction of agitation can help improve the quality of life for both the caregiver and the care receiver. So this is a new program for us. We're very excited. We're at the stage of the training and getting to know how to get some of these playlists going for people. Caregiver Wellness. So during Caregiver Wellness events, caregivers are able to connect with one another in the safe and supportive environment. And it's meant to promote mental and physical well-being. So the wellness specialists will plan these events in all 6 counties based on the caregiver interest and focus. And they're using the following components of health, which are physical activity and relaxation, cognitive stimulation, diet and nutrition, and social engagement. And then finally, we have the education and training program, which here we are collaborating with the Alzheimer's Association of Northeastern New York to deliver these evidence-based dementia education programs. They're person-centered programs that have been created by the National Office of the Alzheimer's Association. And those are in response to clinical evidence and expertise while also incorporating the caregiver and the care receiver experience. So we're very grateful to have this collaboration where we can reach the needs of caregivers across this large and rural region.
Thank you, Valarie. So I'm going to go over some of our services at the Alzheimer's Association. So one of our most popular services is we have a 24/7 helpline that is open to anyone, any time of the day. It's staffed by professionals. My favorite example of how this has been used is one of the constituents I served. Actually, they were really struggling with their spouse at about 2 a.m. So I wasn't available. So they called the 24/7 helpline and they helped that person walk through the fact that their spouse refused to go to sleep. They didn't recognize them. They were wearing 6 or 7 layers of clothing. They couldn't get the clothing off. They were concerned about safety. And that caregiver was really stressed out and didn't know what to do. And so they were able to call the 24/7 helpline. They gave them some suggestions, walked them through, and then the helpline contacted me so that I could follow up with them the next day. So there is a follow-up piece with that as well. So the person will not only receive services from the 24/7 helpline, which is located in our national office in Chicago, but then their local program manager will connect with them as well and make sure they follow up and that things are all settled. We have free education programs, which Valarie just talked about. Thank you very much, Valarie. And we also have a community resource finder, which is located at communityresourcefinder.org. That is a great service because if you type in your zip code, you can search different things that you may be looking for. You can search for long-term care facilities, you can search for housing, you can search for local office for the aging, you can search for many of the things you need, doctor's offices, things like that, right on our website. Our website is alz.org, and there's several different categories. Caregivers have a category on our website. In addition to individuals who have dementia can look at our website and have see resources. Some of our free education programs are, we offer a program that goes over the 10 warning signs. We have an Understanding Alzheimer's and Dementia program. A dementia conversations program, which goes over how to have some of the most difficult conversations, such as what do we do when our loved one shouldn't be driving anymore? How do we take away the car? Those kind of conversations. We also have effective communication strategies. I feel like that is one of the most popular ones in Clinton, Essex, and Franklin counties. That goes over what should be expected and how you would communicate with your loved one so that you can communicate with dignity and respect and also meet their needs. We have a legal and financial planning program and an understanding and responding to dementia-related behaviors program. We, in addition to those, we can tailor programs if there's a specific organization that would like some more information on a particular topic, but maybe they don't want any of these specific education programs. They can contact us and we can kind of tailor something to meet their needs as well. These are free for the public. We host them all over our counties. This week I had one in Scroon Lake. I had a Managing Money program in Scroon Lake. I had a Knowing the 10 Signs in Plattsburgh, and I also had a Understanding Alzheimer's and Dementia in Burke. So we also do one-on-one care consultations as well. If people would like to meet one-on-one, we are happy to meet with them. We can also do family care consultations if the family would like to meet. And those, just like Valarie's program as well, we can meet over the phone, we can meet over Zoom, we can meet in the public. The only difference is we can't go in one-on-one into homes, so we may team up with another organization to be able to go into homes. One of the things that we do is we provide support groups. We have one in each county. We also have virtual support groups. In addition, we have targeted support groups. So we have support groups for individuals who may be in the early stage. We have support groups for men. We have support groups for the sandwich generation who are normally children who are providing support for their parent. We have a variety of support groups that you can actually find online at alz.org/CRF, or you can also find them at wehelpcaregivers.com/support groups. And we are very lucky is that we share our resources on our website, and the Alzheimer's Disease Caregiver Support Initiative also shares their resources on their website. So you really could go to either one and you would hopefully find the information that you need. We also have a variety of different support groups that maybe aren't in the area, but that people can still attend. And some of those may be virtual or over phone. So support groups are incredibly beneficial. People love them. They offer peer-to-peer exchange of information, challenges, possible solutions. It is incredibly stressful to be a caregiver. And so it offers support from other people who are going through something that is very similar. It helps caregivers work through feelings. They share coping strategies. The support group often, in all of the support groups that I facilitate, the support group will kind of rally around the new person and help them work through what is really going on, what are some strategies that worked for them. They also are very understanding of the fact that the strategies that worked for them may not be the strategies that will work for you, but they're still willing to share those strategies. And we also emphasize the importance of maintaining physical and mental health and their own well-being. Because being a caregiver is so stressful, it is really important to take care of yourself through that process. And now I'm going to turn it over to Valarie to talk about the collaboration.
So collaboration. I'm not a huge fan of Wikipedia, but I did roll to that definition. So I like the definition that it gave for collaboration. It's the process of two or more people, entities, or organizations working together to complete a task or achieve a goal. So working separately, the association and the caregiver support program, we can still reach the population, but imagine what we can do as we're collaborating together, because through our program, we don't hold all the resources, and through the association, they don't hold all the resources. But together, we're able to offer more to caregivers, because what we know, as Melissa said, caregivers are so stressed out. I'm a caregiver myself, so we are so stressed out that we'll take anything. We really will. And it doesn't matter, what organization it comes from. We just need assistance and resources. So to have the association and our organization working collaboratively, we're able to offer more. And we are a unique region. Melissa, next slide, please. I forgot to do that before. So I have to move it on my screen. I apologize. So we collaborate together for the outreach, support groups, and education and training so that we can meet the needs of the region. So I'll take a few minutes and describe each one. So as far as outreach goes, for years have gone into establishing relationships throughout the 6-county region. And partnerships have been maintained through regular attendance at long-term care council meetings, enhanced multidisciplinary teams, collaborations with the sheriff's departments, networking with care management and physicians' offices, working with the local offices of the aging, and other valuable community organizations that provide assistance to caregivers of individuals with dementia. So through the collaboration with Northeastern New York Alzheimer's Association, we are able to increase the efforts made to reach the individuals across our underserved communities. We offer more options and opportunities. These efforts include partnering at tabling activities at health fairs, senior nutrition sites, local farmers markets, picnics in the park, and physicians' offices, just to name a few of the areas where we work together for outreach. When we talk about support group facilitators, we try to recruit them with the goal of finding community members to lead these groups. That helps to build trust and rapport, especially in our underserved communities. For those groups in which a volunteer is not possible, as I said before, the association and the caregiver support program work to facilitate and co-facilitate the groups. And they're located at locations and times shared on both of our websites, through our social media company. We really market it so that we're trying to get as much information as we can out to caregivers regarding support groups. And then we talk about the training and education. So as we said before, the association delivers their dementia education programs that are person-centered, evidence-based. The goal is to try to connect with the underserved communities, providing educational information to professionals, caregivers, and community members. The training sessions are held in a number of different locations throughout the region. As Melissa said, she's been all over the North Country just in this past week, trying to get the information out there, trying to increase community awareness and the knowledge of the support services that are available. Next slide. So as I said before, we want caregivers to have access to as many resources as possible in an effort to really provide wraparound support. So we're constantly referring caregivers to their local offices of the aging, the Center of Excellence in Alzheimer's disease, where there are clinical services available, and any other services that caregivers may be unaware of. So it's really our care navigators who are familiar with all of the resources that are available in the area so that we can share those resources and try to assist the caregivers. Next slide. So I was charged with unique needs of the North Country. I've lived in the North Country all my life. I love the North Country. I don't like the cold weather of the North Country, but I love the North Country. So I wanted to, I'm not a big statistics person, but I think that these statistics are mind-blowing. So if I'm using 11.3% as my estimate of Alzheimer's disease in persons who are 65 years and older, and I use the US Census Bureau from 2015 to 2019, if I look at their population statistics, I get the following numbers. And these are the number of individuals that will develop Alzheimer's disease across our region. So just take a moment. Clinton, 1,607 people. Essex, rural area, 1,011. Franklin, 986. Hamilton, 159. Warren, 1658. Washington, 1389. That totals 6,810 people just within the 6-county region who are likely to develop Alzheimer's disease or another form of dementia. Next slide, please. And I know you've been hearing me talk about the underserved. I keep using the word underserved, and many of you are probably like, what does she mean by underserved? What do we call underserved? Well, we defined it. We had to define it in order to get our grant. So we were awarded with an $8.25 million grant to serve these 6 counties. So Clinton, Essex, Franklin, Warren, Washington, and Hamilton. And they added a goal onto this year, and it was to reach the underserved. So we had to define who our underserved are. And our underserved are those that are rural and those who are economically disadvantaged. So I want to be more specific. So within our 6-county region, Essex and Hamilton counties are underserved. They're based on the population size. Franklin County is considered underserved because of low socioeconomic status. So just to even dive a little further with more statistics at 1:24 on a Friday afternoon. So Franklin, Clinton, and Essex counties hold the highest populations for low socioeconomic status. And so Franklin is 18.1%. Hamilton and Essex counties report a population per square mile of 2.8 for Hamilton and 21.9. So those are our underserved. We are given a little more money to really reach those individuals in those underserved communities, because what we know is it's hard to find the resources in the underserved. Next slide. So according to the report of Committee on Ways and Means of the U.S. House of Representatives left out, Barriers to health equity for rural and underserved communities. So these are our barriers. Workforce shortage, which I am sure over the past week you've heard a lot about. Workforce shortage is one of the greatest gaps in service to rural communities. So the workforce gap in service results in higher mortality rates due to a shortage of primary care providers and an availability of behavioral health services. Next slide. So when those individuals who reside in rural communities are unable to find behavioral health services that are accessible and available, they turn to primary care physicians' offices. And they use this as a resource when the specific behavioral health expertise are not possible. So according to the 2020 county health rankings, Hamilton County ranks 4,490 to 1 for a ratio of population to primary care physicians. And Essex is reported at 2,370 to 1. So limited access to primary care physicians results in this unnecessary emergency room visits that we hear a lot of discussion about, and it results in hospitalizations. So my question is, how do you expect to decrease the overutilization of emergency room services when these are our populations to our primary care physicians? Next slide. So I'll turn it back over to Melissa, who can talk about some of our case studies that we have in the North Country that highlight our collaboration.
So I provide the example for 2 different case studies that both organizations worked with together. These are false names, just to be clear. So the first case study is Joan. So in this situation, the Alzheimer's Association received a referral. The husband is diagnosed with dementia. Joan is disabled. She's unable to drive. That is a stressor because her husband is also at the point where he should not be driving. However, in order to access resources, he is driving when both of them feel that he shouldn't be. Due to family values, Joan was really uncomfortable having people come to the home. She did not feel like it was something that she needed. She didn't feel like she needed resources at that moment. So she was a little bit uncomfortable with the idea of talking to people. Joan and her husband live 40 minutes away from most resources. There is a grocery store, but it's pretty small and pretty expensive. And that particular grocery store is about 15 minutes away. Joan felt very isolated. She didn't feel like she had anyone to talk to. And she really was curious. She sought normalization. She didn't know if what her husband was going through was normal. And so she wanted to talk to someone. So when I received that referral, I talked with her probably about 3 times before she was comfortable enough to say, you know, I actually need this. I need resources. And yes, I'm okay with you referring me to the Alzheimer's Disease Caregiver Support Initiative. And then once she became comfortable, I contacted Joanne, who covers Plattsburgh area for the Alzheimer's Disease Caregiver Support Initiative, and she contacted them to connect them to resources as well. So now Joan was getting 2 sources of resources, and she also called me pretty frequently because she was just feeling pretty isolated, pretty stressed out. And we encourage people to do that. If you need somebody to talk to, please call us. It doesn't have to be something that you feel is an emergency or a crisis. Call us if you're stressed out. We'll walk you through it. We'll provide support, and we'll kind of normalize your experience. So we were able to also connect her to RSVP volunteers, which provided her with transportation. So she was able to get to the grocery store. She right now isn't so comfortable using respite. She still isn't sure she wants somebody in the home, but we're still building that connection between Joanne and I. We talk with her. I talk with her quite often, and we're hoping that she will see that might be a service she would benefit from in the future. In addition, Joan was really uncomfortable going to support groups. She was really uncomfortable meeting other people in person, but we were able to introduce her to our virtual support group where she could get support online. I also gave her the information for telephone support groups as well in case she was more comfortable with that. And our next case study, we're going to call him Fred. So Fred is the primary caregiver for his wife. His wife has Alzheimer's disease. Fred isn't able to leave his wife alone. He felt very isolated. He felt disconnected from friends. He used to visit his friends each week, go for coffee in the morning. He just felt like it was too much to try to leave his wife alone, and he didn't know what to do. So Fred really sought disease education as well. In this case, Joanne received the referral. She invited him and his wife to a memory cafe. And so they participated in the memory cafe. They loved it. And then for the second half of the memory cafe, I pull caregivers aside so they can meet together and have a support group. So Fred was able to attend our support group at that time where he met some other peers and was able to talk through some of the things going on, to talk through what do they do, to talk through some of the caregivers that they might use. And as time went on, he became more comfortable and he had more peer support. He also was able to utilize some of the respite. In addition, he was referred to the Office for the Aging, and he was able to get an aide so that he could attend education programs. He was very concerned about, is what I am saying correct? Is what I'm saying, should I be saying what I'm saying? He wasn't quite sure. He really wanted to do the right thing. He just wasn't sure if he was doing the right thing. And so he really wanted to attend an effective communication education program. And at the beginning, he wasn't able to because he didn't have the support needed. He was offered virtual, but he was more comfortable attending in person. And through the collaboration, we were able to get him the supports. Not only were him and his wife able to attend a memory cafe, he was able to get the support from the support group, but he was also able to attend education programs, meeting many of his needs. So I am going to kind of go over one more case study that I think is a little bit interesting. So we received a referral for someone who lived remotely as well. We run into it very often where isolation is a struggle for people who live remotely. So they were also feeling very isolated. They were very, very willing to be referred to the Alzheimer's Disease Caregiver Support Initiative. So in this case, it was a different care navigator, Megan. So Megan and I spoke about this woman's situation. She went and met with her. She talked about her services, what the needs were. Between the two of us, we actually established some different needs because some needs were talked about with one of us, some needs with the other one. So we were able to work together to figure out what we offered her all of the services, but we kind of navigated down to what are the real needs and what should we prioritize. One of the things that we found was a real need was attending support groups. And so we provided information on local support groups, also support groups that were online and virtual because she wasn't sure if she could get out to the in-person support group. In addition, she was really curious about respite and or maybe having a home health aide. Unfortunately, we know with the lack of providers, sometimes it can be very hard to get a home health aide, and she was kind of nervous about it in general. So while she didn't want to utilize respite right now, Megan still introduced it to her because she wanted her to know what the services and supports were so that when she gets to a point, she knows that those services are there for her to access. So does anybody have any questions that can be about anything we talked about today? And I'm going to stop sharing.
Perfect. I did get one question that just said, how would you go about connecting someone to support and resources who may not realize that their spouse is showing signs of Alzheimer's? In this example, wife is showing signs of Alzheimer's and children and family have acknowledged it, but husband may be in denial.
I don't know if you want to jump on this, Valarie. I can kind of give my perspective real quick.
Sure.
So one of the things that I find are beneficial are education programs because it's not as threatening as having a one-on-one conversation. Sometimes that can be really scary for people to have a one-on-one conversation. But attending an education program, maybe with a friend or someone else, might be beneficial. A lot of times I offer them in long-term care facilities for caregivers. Or I also offer them in 55 plus communities as well, so that people attend with their friends. They may tell another friend who comes. Know the 10 warning signs is a popular one where people attend, but that doesn't necessarily mean they have the disease or they're admitting that somebody else has a disease. That's what I would recommend maybe starting with.
I focus on rapport building. I find that I can jump in and I can provide information, but I can also overwhelm, and denial is a very difficult thing. My experience is that I tend to work well one-on-one when I listen and maybe take the extra time, and it might not, like the case study that Melissa said, she's had to meet with them a few times. Sometimes that's the case, sometimes it's more than that. But it, reassuring that you understand, but maybe educating as you go and saying, oh, when they repeat their sentences, that's so difficult, isn't it? Does your loved one do that a lot? Yeah, that can be really tough. And sharing gently to help with that process of determining, maybe something isn't quite right. And really listening to understand the reason for the denial. You've been married for 55 years. It's really tough. It's a tough pill to swallow. So just really taking time to actively listen.
Got that. They did follow up and just say, are there educational programs or resources that can be sent to their home? I think it's similar to that other situation you had with Joan. Was it Joan? No, it wasn't Joan. Where they didn't want to leave their wife alone. And so that's the concern. Something they can sign up for. Maybe they can start with that and then do a rapport from there.
Absolutely. We can send materials home. We can talk on the phone. We can be very flexible about how we get that information to them. If this is a specific situation, you're certainly welcome to leave your email, and Valarie and I can get back to you.
Okay. I'll let them know. Thank you. One of the other questions in the chat is, this one's for Valarie. How different are the Alzheimer's statistics in these 5 counties from the national average? I think the ones you mentioned earlier.
I would love to say that I know that right off the top of my head, but I don't. I'm the first person to say if I don't know something right off. Melissa, I'm not sure. I know that you work with the national group, but I would certainly be happy to take those numbers and compare them with national averages, and I would be able to share that if somebody wants to leave me their information. I always love a challenge.
I get that. And those numbers seem shocking, especially for a lot of the work that the Adirondack Rural Health Network does with our local health departments and hospitals. We dig into the counties and populations and demographics. And so it was kind of shocking to see that many people listed out.
It is. And when you start thinking of dementia and Alzheimer's and all of those, 6,000 plus people, how can one organization reach it all?
Right.
This is where collaboration is necessary. In our rural populations where primary health care, we just don't have enough health care for people. We don't have enough resources. We don't have enough respite care. And yet our population of people with Alzheimer's and dementia just keeps getting bigger and bigger. How can we do it alone? We can't. We don't even ask caregivers to do it alone. We tell them to get a support squad. So our organizations need to step up and start collaborating together without thinking of it as competition, because we can't reach the numbers alone. So what better way to really care about our communities, the community that I say I love? Well, I care about them. And so in order to do that, we've got to try to get them as much as we can so that they can survive, because that's what all of us caregivers are trying to do right now, just trying to survive.
That's a great way to put it. I think we're always trying to encourage more and more collaboration. And I think I said this earlier in the week in another presentation, but COVID definitely, in my mind, or at least with my partners, has definitely built collaboration. So I'm hoping that that stays true. Does anybody else have any other questions or comments that they'd like to put in the chat? You can unmute if you'd like as well. We do have that setting available.
One of the other things I wanted to mention, I forgot to mention, is that we have an upcoming professional development series. You can take one or many of the programs. It's free. You get free CEUs. So if anyone is interested, feel free to reach out to me or Valarie. Is it okay for me to put my email in the chat, Sarah?
Definitely. I was just going to tell you to do that. And I would also like those resources.
Absolutely.
That would be something great that ARHN could partner with you guys on. All right, I'll give it a minute for questions or so, and then if not, we can wrap up the summit. Can't believe this week flew by already. I was actually really impressed with your presentation. I'm so familiar with Alzheimer's Association through Molly McCann-Mall and through Lindsay Stanislawski, but I think the approach you guys took on it today is different, and I really liked the use of the case studies because that kind of brings it to home, and you can fully understand how you can address things, you know, how you can handle different situations. So we really appreciate you guys. I'm not seeing any other comments or questions in the chat, but you guys did leave your emails, so please feel free to reach out to Melissa and Valarie for them to make sure that if they have any questions. Yeah.
Sorry, I just wanted to
No.
say that Dr. Anand did raise her hand.
Oh, I did not see it.
Hi, I'm Melissa and Valarie. I'm a faculty at the School of Social Work and the Education Department. And this morning I presented on burnout amongst physicians and staff shortage. So my heart is really going out for the amazing work you're doing with Alzheimer's and the population. I presented on social determinants of health. And what stood out about your presentation and some of the questions I have a burning list of questions, I will get in touch with you. I think what you're doing is really exciting. I just wanted to give a shout out and say you guys are doing an amazing job and impressive work. Great work.
Thank you very much.
I struggled to hear, so I apologize.
I'm going to give
She
you a
said you're
heart.
doing
Let's just put
amazing.
it that way.
She gave you a heart and said thank you, and it was amazing.
Oh.
And she's going to get in contact with you. You also have a comment from Sarah Granquist saying, thank you, Melissa and Valarie, good job. And so, yeah, it looks like you have a lot of support. That's what I like to see.
That's right.
Yeah, thank you guys so much. We appreciate it. Like I said, their emails are in the chat. So if you have any questions or comments, you want to leave them, please feel free. You can also always contact us at the AHI Summit email, myself, Nancy, or Andrea, and we can connect you with presenters from this week as well. But I'm going to wrap it up and say thank you guys so much for presenting. This was our last session of the 2022 North Country Leadership Summit. All the sessions this week, thank you, Phyllis. Phyllis said thank you for the wonderful info. All the sessions this week have been recorded. They will be archived, like I said, on the AHI YouTube page and on the North Country Leadership Summit webpage. So please feel free to reach out and check those out when they're up. And if you have any questions, connect with us. And from there, have a good weekend. Thank you guys for all attending, and we'll talk to you all soon.
Thank you, everyone.
Everyone.
Bye.
Bye.